The question is, would I support a single-payer system model in the VA? The real answer is the single-payer system is good if the single payer is the individual citizen. The problem is if we have, there are two options that some people think we're limited to. One is, let's give it to the government, let them be the single payer. That's a lot of the Democrats' plan. Let me tell you, I don't think that's a great plan because there's some things the government does well, some things they don't do that well. I don't know that I want to trust the government with the health decisions of my life. Now the Republicans, on the other hand, well, just understand. The Republicans, on the other hand, will sometimes say, no, we got to turn it all over to the private insurance companies. Well, I'm a Republican, but let me tell you, I don't trust the private insurance companies a whole lot more than I trust the government. Let me tell you who I trust. I trust me. Nobody cares more about how long I live and how well I live than I do. Now the question is, how do we empower you to be able to afford quality health care? Because that really ought to be the goal. Not that the government would give it to you, because if the government gives it to you, they can take it away. The insurance companies give it to you, they can take it away when they think you're too expensive. When you own it and have some empowerment, but you can also afford it, that's how we get there. The reason we don't have universal health care is because most of our expenses in the healthcare system are spent on chronic disease, and we're overloaded on the backside of disease. 80%, think about this, 80% of all of our healthcare expenses are toward chronic disease. We have a system that waits until we're catastrophically ill and then tries to fix us like Humpty Dumpty having fallen off the wall. We need to change the whole healthcare model to a prevention-based system so that our coverage is based on preventing the illnesses and being well and healthy rather than on the most expensive way of getting it done. Doesn't happen overnight, but we did things in Arkansas when I was governor that actually started moving us to the prevention base. Cutting out the co-pays and the deductibles on mammography, prostate cancer exam, colonoscopies. For the screenings are always less expensive than stage 4 cancer. Giving people discounts on health insurance if they did a health risk assessment and didn't smoke, because it's cheaper if they don't. Covering things like weight loss programs, because the truth is if people manage their weight and they don't become diabetic, it's a lot less expensive than if they don't take care of themselves. Build in the incentives, but it's individually empowering, and the government's not going to tell you how to live. That's not the government's job. But if you make some good choices, it's less expensive. We can get to universal health care, but we can't get there if the only thing we do is to say, let's just give everybody coverage, but we're not going to create a system in which we start focusing on prevention rather than intervention. And I don't believe anybody perhaps has dealt any more deeply into this issue than I have, in part because in my own life, 5 years ago, there was 110 pounds more of me than you see today. 5 years ago, I went to my doctor, and he told me that I had become a type 2 diabetic. And he said, if you don't change your lifestyle, he said, you're starting the last decade of your life. And then he described it. And quite frankly, by the time he got through describing it, I decided we needed a new exit strategy for my life. So I started changing the way I ate, which meant in the South, I quit eating all the fried foods. Boy, that's tough when you grow up down there. Hey, folks, you don't understand. We fry everything we eat in the South, everything. And I started exercising, and now I've completed 4 marathons. I'm training for my 5th one. And I was never, ever a person to exercise. I had to learn that I needed to take better care of me. And when I started doing it, my health care expenses went dramatically down. I don't only feel better, I don't look any better, unfortunately, but I feel better, I'm going to live longer, and I'm not going to be nearly as expensive as I used to be. And I came to understand, by the way, I was able to overcome the type 2 diabetes by dealing with it aggressively and early, and it made a huge difference. And I'm not saying I'm going to personally put America on some weight loss plan or tell them what they can eat or can't eat. I'm not that dumb. We'd have a mutiny on our hands. But we have to have a system that creates the incentives so that we make better choices and we have results and rewards for having done so. And we can get there. 3 basic things to health care: access, quality, and affordability. All 3 things have to be in place in a health care system. If you don't have all 3, you don't have a health care system. And right now, we don't have one. Yes?